fractures are a major concern among the elderly, with global cases expected to rise dramatically in the coming decades. These injuries not only lead to significant disability but also carry a high risk of complications, including urinary tract infections (UTIs). According to recent systematic reviews, UTIs are one of the most common complications after hip fracture, affecting up to 11% of patients. Consequences are serious: increased mortality, prolonged hospital stays, and higher healthcare costs. Understanding why UTIs occur in this vulnerable population is crucial for doctors and caregivers. This video will explore the main risk factors identified in the latest research, helping us recognize high-risk patients and guiding early intervention strategies. Let's start by looking at the scope and impact of hip fractures and UTIs in geriatric patients. Recent meta-analyses have revealed 18 significant risk factors for developing UTIs after hip fracture. Among the most prominent are being female, advanced age, obesity, and urinary catheterization. Female patients are particularly susceptible due to anatomical and hormonal changes, especially after menopause. Catheterization, often used during hospitalization, can damage the urinary tract lining and provide a pathway for bacteria, increasing infection risk. The factors include blood transfusion, high American Society of Anesthesiologists (ASA) scores, general anesthesia, certain fracture types, and prolonged hospital stays. Mental health conditions like delirium, dementia, and Parkinson's disease also play a role, as do chronic illnesses such as diabetes, hypertension, heart failure, and history of sepsis. Recognizing these risk factors allows clinicians to identify patients who need closer monitoring and preventive care. Reduce UTI occurrence in hip fracture patients. A systematic approach is recommended. First, assess each patient for risk factors upon admission, paying special attention to those who are female, older, obese, or have mental disorders or a history of sepsis. Enhanced urethral care and regular urine testing during hospitalization are advised for high-risk individuals. Prophylactic antibiotics may be considered in select cases. Patients not at high risk, early mobilization and minimizing hospital stay duration can help lower infection rates. Catheter use should be carefully evaluated, with prompt removal or individualized assessment to avoid unnecessary exposure. Special attention should also be given to those undergoing general anesthesia or blood transfusion. By targeting these strategies, healthcare providers can improve outcomes and reduce the burden of UTIs in this vulnerable population. Summary: UTIs are a frequent and serious complication in geriatric hip fracture patients. The systematic review highlights the importance of identifying risk factors such as gender, age, obesity, catheterization, and comorbidities. Early intervention and targeted management can significantly reduce UTI rates and improve patient outcomes. While more research is needed to clarify some associations, current evidence provides actionable strategies for clinicians. By focusing on high-risk groups and implementing preventive measures, healthcare teams can make a meaningful difference in the lives of elderly hip fracture patients. The findings underscore the need for ongoing vigilance and personalized care in hospital settings.